According to Indian philosophy, life is an individual effort to experience the outer world. An individual will be looking out through a maximum of 5 sense organs with the help of mind to experience the outer world. So physically, body is made up of 5 sense organs with the help of which alone one can experience the outer world. Whatever knowledge is created with the help of these 5 sense organs about the constituent elements of the world, it will be of 5 varieties. These constituent elements known through 5 sense organs are basically known as Pancha Bhutas. Everything in the world will be made up of Pancha Bhutas, including the physical structure. So Ayurveda considers that an individual extends down through the mind and further get connected to 5 sense organs to experience the whole world. So physical body is also made up of these 5 constituent elements known as Pancha Mahabhutas. Pregnancy or Garbha is a fertilization of ovum and sperm in the right time to create a physical structure. Much before the physical structure is created, the individual must have decided to come down to this earth and take a physical life. As an effort of this, individual will be transforming into the mental plane and then getting connected to the 5 physical sense organs, so that an individual in toto is created. Our effort is to create a maximum healthy status of mind and a maximum healthy status for the physical structures. As a preparation to the conception, everybody should bear in mind that mind should be healthy as much as possible and physical structures are healthy as much as possible, since these two things are transferred directly from the parents to the progeny. So here we will be trying to explain the modes by which you can keep a healthier mind and you can ensure that the physical structures are also healthy, so that a healthy progeny is ensured herewith. Once the fertilization is taken place in a very pleasant atmosphere and subsequently the pregnancy is confirmed, it is important to see that the pregnancy is carried forward in a very smooth and healthy way. The period of 9 months can be divided into 3 portions: first trimester, second trimester and third trimester. The first 3 months is very important for having a healthy implantation of the fetus. For that, what we suggest is nursing care by the husband himself or a reliable nurses will ensure that overall care of the lady is comfortably managed. Food items which are dominant with butter, ghee and milk in the required amount will ensure that the body is sufficiently lubricated and made healthier, so that the movements inside the body is smooth and results in a very healthy implantation of the fetus. First 3 months are important for certain digestive disorders like vomiting and all, which will not be stopped with any other medicines. So these kind of food items will ensure that intestinal movements are smooth and subsequently the vomiting and all is controlled without having any artificial medication. First trimester is also important for the extra desires the pregnant woman will be expressing, because there is an additional development of heart for the fetus and desires will be expressed through the mother herself. These desires have to be fulfilled as much as possible to see that the child is also satisfied with whatever desires he is developing in his mind. We have to take care to see that whatever desire is there, it doesn't go against the basic structures or health of the mother and the child. Rest of the desires can be fulfilled, so that the development in the initial stages of the mind and the body is made smoother. The second trimester is important for the full development of the mind, and this is one of the important aspects Ayurveda is trying to offer to the world. Development of the mind is ensured actually in the 5th month. From the 3rd month onwards, the fetus will be starting to get the experience of the mental plane directly from the mother. Hence, the emotions like irritation, agitation, anger, anxiety, tension, stress, etc. have to be reduced or restricted as much as possible, because these emotions are directly transferred to the child and it will be reflected in the growth of the mind of the fetus as well. In the 3rd trimester, 8th month is most important. Even though the physical growth of the child is complete, the essence of the fetus or an individual body known as ojas will be traveling between the child and the mother, and it will not be stabilized. So, we have to ensure that the 8th month is very smoothly passed, so that the establishment of the ojas or the essence of the physical body is done very well in the child. 9th month onwards, you can expect the delivery on any date. So, we have to ensure that movement of the body in the subtle plane and the mental plane is very smooth. So, use of oil externally and oily things like ghee or milk internally up to the requirement of the mother and child will ensure that movements in the subtle parts of the body is very comfortable. Intestinal movements also has to be made smoother with whatever medication is needed, so that downward movement through the intestine will be normally conducted, and that will be contributing to the easy passage of the fetus through the delivery passage. Just after the delivery is over, we have to ensure that the movements in the body or vayu which are severely disturbed throughout the body is restored itself. For that, we have to console the mother and make her happy, so that movements disturbed as a result of the strain of delivery is re-established from the physical plane as well as the mental plane. Once the movement is re-established and the mother is relaxed, the disturbed and weakened intestine has to be taken care of. Basic tonics like milk or ghee, along with the digestive medicines like pepper or ginger in very small doses, can be induced to see that the digestive process is again re-established. Before giving any other nourishing things or even medication, we have to ensure that the digestive system is regained first, then whatever is introduced through the intestine will be absorbed well and distributed all over the body for the purpose of regaining the body. Usually these kind of re-establishing the body will take 1 month to 1.5 months time. Till then, any kind of strenuous activities and over eating and heavy foods have to be carefully avoided, so that strain due to the delivery is completely avoided and body is regained totally from the strain of the delivery. Throughout the pregnancy, we have to ensure that the movements of the intestine is made smooth as much as possible. From the intestine only rest of the movements are ensured. So, any kind of difficulties that could be created in the intestinal movements like motion or urine or any other vomiting, sneezing, coughing, all movements which are related or making impact on the intestinal movements have to be made very smoother. Any urges which will be preventing these movements have to be carefully executed without straining rest of the body. Any heavy food items and spicy food items have to be restricted, and oily and masala items have to be limited. Emotions like anger, agitation or anxiety should be limited to see that the mind is also pacified at all stages of pregnancy.
Every individual is unique, and Ayurveda respects all the levels of an individual. It offers natural ways to heal people of all their sicknesses in a physical plane or mental plane. It empowers humans to take responsibility for their own well-being. This time-tested medical science is very cost-effective and time-tested. To summarize, Ayurveda is an ancient science for modern lifestyle which aims as consciousness-based approach for their own healthy and well-being.